My guest today is Adrian Burton, the Chief Information Officer at the Health Resources and Services Administration in the Department of Health and Human Services. Adrian, welcome to the program.
Thank you, Jason. It's glad to be back.
It's great to catch up with you again. It's been several years, I think, and there's plenty going on. But we're going to focus our discussion today on remote work. We're going to focus our discussion today on employees returning to the office as more and more employees get vaccinated, as people become more comfortable with the idea of returning to the office. So let's just start maybe at the beginning. And when you look back over the last year during the COVID-19 pandemic, discuss what worked, what were some of the more challenges that you faced as employees transitioned to remote work, obviously with your title as a CIO from a CIO's perspective.
So I'm happy to say that a lot went right at HRSA when we transitioned to 100% telework. HRSA has been a long supporter of telework. In fact, many staff, they telework 1 day a week, maybe some telework a little bit more, some telework a little bit less. But anyway, so staff was already familiar with using the VPN. So we have a robust VPN infrastructure that can support, simultaneous users. We've used it. And for instance, when there's been snowstorms where we have 100% of the people, on at the same time. So I think that, for the most part, people were used to using VPN as well as the collaboration tools. At the time, we used Skype and Adobe Connect. So staff was familiar with using those tools. I think that for us, it was really, making sure that you're ready for an emergency. And this is part of HRSA as well as HHS coup planning, is to make sure that you're prepared for an emergency, but no one could foresee that we would telework for, a year straight like we have, but we were ready for it. My staff has been absolutely awesome. So we always try to make sure that we're prepared. Some of the things that we weren't quite prepared for was, the safety protocols that need to be put in place with COVID-19 and interfacing with people, especially with our help desk support. So what we did is that we adjusted our procedures and we made some changes we provided remote support anyway, and we used different tools to provide remote support. However, we still needed to onboard people when they came into the office. So of course, we needed to maintain the 6 feet for the social distancing. We need to make sure that staff had masks as well as gloves. And then another thing that we had to adjust is when people had issues with their laptop, is that we would give them a loaner as opposed to trying to repair their laptop on right away. And so what we would do is that we would give them a loaner, wait a couple of days, work on the laptop, and then return their laptop to them. So for us, it was really around the safety protocols that we needed to put in place to continue to support staff. And overall, our mission has not stopped at all.
That's a great, a lot of good news there. I'm going to back up for one thing. And the help desk support piece was interesting. And I think that's one of the areas I hear a lot from other CIOs who say, well, we're so used to doing this in person. And as you said, you use some tools for remote working. Was most of your help desk on premise, or were some teleworking some days a week or some teleworking most of the time? That and as you said, the laptop issue are two of the areas that I hear a lot about.
For the most part, our help desk support is on site. So, and we also have 10 regional offices that we supported remotely. And then we had people that were teleworking that we supported remotely. So we use the LAN desk technology where we can take over someone's laptop to actually troubleshoot. So that was not new to us at all. So that's typically how we provided support. However, during this instance, we did work with our vendor to provide some on-site support for employees where the vendor would dispatch someone, for instance, to replace a battery or to handle some of the hardware changes to existing laptops that we had.
One of the things that you hear about, for instance, when the laptop breaks, what do you do? The loaner one was a good example. I know some agencies have used kiosks. Was that something that came up where you put a kiosk in with the laptop that's broken and get a kiosk that gives you one with a laptop that's not broken? Was there any sort of technology in that sense that was borrowed, used, or tried out?
Not from a technology perspective, but we would have a cart that folks could drop off their laptop that was experiencing a problem, and then they would pick up the loaner from another cart. And so we, of course, made sure that the carts were distanced so that we didn't have to be right there to physically interact with folks. I mean, we could do it with a certain amount of social distancing in place. And so that's what we, just some of the basic process improvements is what we actually implemented.
The implementation of these, it sounds like from an implementation standpoint, you were not one of those agencies that had to quickly upgrade VPN access. You didn't have to quickly get out laptops. It seems like a lot of this you were prepared for, as you said, a lot of the COOP planning that came through. But when you look back and okay, here's what worked, here's some of the things that worked better than maybe we thought it did. Are there plans in place, or are you putting plans in place to sustain and optimize some of those technology changes that you had implemented over the last year?
Well, I think that one of the things that we've been working on is improving access to information to make it easier for folks to find information. So what we've done is we have a lot of short little video clips on how to use technology. For instance, we just recently migrated from Skype to Microsoft Teams. And so what we've done is set up a lot of video clips for online support for folks. And so those are just some of the things that we're doing in regards to sustaining that and making sure that people can find information more easily as well. And then what we've done is that if folks need to come into the building, they would schedule an appointment to make sure that we maintain socially distancing. And then when we do onboarding for folks, what we do is we issue the laptop to the employee, and then they need to validate that they can connect to VPN right away. And then we send them off, and then they continue to work from home.
That's probably been the biggest change too, is that onboarding. For previously, it was nope, you got to show up. You have to spend 3 hours going through all the processes, learning how your laptop works. All of a sudden, folks like yourself realized, well, we can do almost everything from home. I mean, I've heard cases where agencies have shipped new employees a laptop, and as soon as they plugged in and connected to the Wi-Fi or the internet, then the help desk could help them kind of get set up in the VPN world. Did you have any sort of remote worker, new employee enrollment effort that was different than maybe what you had started with?
Well, we explored that in terms of actually shipping the laptops to the new employees, but they needed to come in for their PIV card anyway, and it didn't make sense to separate the two functions. And so what happens is that they would go into the badging office, get their PIV card, and then immediately they could go pick up their laptop bag, validate that they could access VPN, because I think it's easier to try to troubleshoot that VPN access in person, especially for people that have not used HRSA's VPN at all. And so that was just easier to integrate those two steps. And then after that, they go home and then they complete the new employee orientation that HRSA has.
Adrian, one of the things that occurs to me as we are talking through this is it's one thing to come in, get your laptop, but because that people had to work from home and they had to access data, they had to make sure they could get to the applications. Is this something that you all were prepared for because you had done the IT modernization, in 2019 and 2018 previously? So the remote work was not that challenging, or did you have to do some other things to ensure that employees could work, could access their data, could access their applications from anywhere at any time?
For the most part, folks could access all of our applications. However, HHS, specifically HRSA, we've been involved with the Provider Relief Fund. We've been responsible for that. And so that's a new program that HRSA received in April of 2020. And we received $100 billion initially, and then $75 billion. And so the whole thing was trying to stand up that program very quickly. And so what we did is we implemented a COCO model, a contractor-owned, contractor-operated model for that program, but we also had to complement that service with some of the platform as a service offerings as well to support the Provider Relief Fund. So we have had a lot of activities going on with HRSA, not just our normal programs, but additional programs. Another program that we received was standing up the telehealth.hhs.gov, which was a new site to support HHS's response to COVID. So we've had a lot of work that's been going on. And then recently we received $2.5 billion for grants for various programs within HRSA. So my staff has been working with program folks to figure out ways to expedite the disbursement of the grants. So typically the grant cycle takes anywhere from 90 to 120 days. And so what we did is that we were able to reduce that initially to 18 days for the first round of COVID grants, and then we reduced it to 12 days, and then finally we reduced it to 5 days. So there's been a lot of activity, from an IT perspective and support of the programs. And then also keep in mind that when folks went to 100% telework, you also have all these different remote meetings and different things like that. And so IT has just been really at the forefront with supporting all of the mission activities that needed to take place in such a short time frame.
That's awesome. That's a great success story of going from 90 to 120 days down to 5 days on average, of course.
Yes.
We know everyone's a little different. What was the IT role in that? Because I think that's obviously when we talk about procurement as an example, well, we got a lot of agencies talk about getting VPN set up in record time. And if we could do it during the urgency of COVID, why can't we do it all the time? I'm sure the grant folks are like, well, if you can do it during COVID, why can't HRSA do it all the time? So what was the role of IT to kind of speed up that time?
Well, what we did is we had daily meetings with the program folks in regards to the grants that needed to go out. We had various programs like the Health Center program, our workforce programs, maternal and child health programs. So they all had a certain amount of funding that they needed to issue out in regards to grants. But what we did is we held daily meetings with all of those key stakeholders, and we learned each time that we dispersed grants for different parts of the organization. And we were able to reuse some of those processes and also automation using some scripts to try to make it easier for folks. I mean, we basically saved thousands of hours in reducing the grantee burden to actually, receive the awards. We reduced the time, for instance, for issuing funding memos and various other internal activities. And so we were really proud of the work that we did. Like I said, IT is partnering closely with the business to actually make those things happen. But it's a team effort. And like I said, we were extremely proud of all the work that we've accomplished in this last year. I mean, this has been a really busy, extremely busy year.
That's an understatement to say the least. An extremely busy year, yes. But congratulations on the progress on grants. Adrian, let's take a quick break. When we come back, we can continue our conversation. My guest today is Adrian Burton, the Chief Information Officer at the Health Resources and Services Administration in HHS. I'm Jason Miller, and you're listening to Modernizing Government: How Employees Can Thrive in this Hybrid Work Environment, sponsored by KPMG on Federal News Network.